family, welcome or welcome back to my channel. If you are new here, my name is Brakia, and my channel, of course, name is Natural Soul. I basically do a lot of nursing content here, and I'm starting to do a little bit more of lifestyle. So if that's something that you're interested in, please go ahead and hit your subscribe button and your notification bell so you'll be notified when I do post new content. In today's video, I'm going to be discussing wounds. Wounds are something that's like very important in long-term care, so I just want to touch bases on that a little bit. So yeah, we're going to be talking about wounds today, you guys. So if that's something that you want to hear about, please go ahead and hit the like button and stick around. Let's go ahead and get into it. If you see me looking off to the side, it's because I have my notes, and it's just something so I can, you know, keep up with what I'm saying and I won't forget to mention things. First thing first, we all know that a wound is an injury to the skin. So we're just going to go over different types of wounds that you will see long-term care setting. Surgical incisions, burns. I don't see burns much, but I do see a lot of surgical incisions. People come in a lot after hip surgery, knee replacement, a lot of stuff. They come in after a lot of surgical procedures just so they can recover within those 21 days. So a lot of them do rehab, and that is in the long-term care skilled nursing facilities. You see a lot of people coming in for rehab, and they have a lot of surgical incisions. I don't see too many burns, but you will come across some people that have been burned that'll come in. Lacerations and skin tears, that's something that you will see a lot because you have a lot of people that fall in long-term care and they get those lacerations, and their skin in the older community is so fragile, so thin, so you will see a lot of skin tears. Skin tears happen often, and I'm saying like often because their skin is like paper. They can bump it and then boom, you got a skin tear. So that's a big thing you'll see. And then you also have wounds like blisters, hematomas, and contusions, and those are the closed wounds. So you see it all. You treat all of them like they're a big deal because one small skin tear can turn into something really, really big. So treat all of your wounds like a priority because you don't want something so small to turn into something so big. All right, and that's exactly what I had to say next. Don't overlook any wounds, whether it be big or small. Report and document any and all wounds that you noted. If you don't have a wound care doctor, if you don't have a wound care nurse, because some facilities don't, some facilities do, which is great if they do, because they can stay on top of the wounds. That's something that they do every day. And then you'll have a doctor to come in like once a week, like on Wednesdays or whatever. But it's very good if you have a wound care nurse. And if you do, make sure you are reporting any of these skin tears or whatever it is. If the wound is not healing right, whatever the case may be, make sure you are reporting it to the wound care nurse so that they can relay it to the doctor, and so on and so forth. It's important also to know when a wound is becoming infected. You'll see pus, you'll see redness. Sometimes it'll have an odor. It'll be sore to touch. So if you notice any of these things around the wound, make sure you are letting the wound care nurse know, or make sure you are calling the doctor so they can put a treatment in place. If they have staples and things like that and it's getting like really, really red and swollen and stuff is draining out, you need to make sure you let somebody know, because they might need to go back to the hospital where the procedure was done so they can do something about it. If you see a skin tear that's getting to this level, make sure you let someone know. Okay, I forgot where I was at because I got interrupted, you guys. But like I was saying, any wound can become infected, whether it's a big wound or small wound, bed sores, skin tears, whatever the case may be. Just make sure you are monitoring them and make sure you are able to notice when one is becoming infected. Now, you do have some wounds with the residents that are chronic and non-healing. And you will mostly see the non-healing chronic wounds in diabetic patients, patients that are anemic, patients that have a poor diet, cancer patient, kidney disease patients, people that are confined to a bed or a wheelchair, and people that have circulation problems. Now, these will be your ones that really keep an eye on, because they can go left real quick, like real quick. And another way for you to notice that this is happening is basically kind of like the same as if it's infected. You'll see darkness in the area around the wound, like around the edges of the wound. It'll be dark. It'll have like fever in it. It'll be red, puffy, sore, and it have an odor to it. So if you notice any of these signs, pus, redness, warmth, bad color, increased pain, darkening, any of that, that has gotten to an issue at that point. But if you see those things, make sure it's being reported so that they can put some type of treatment in place. Maybe they'll have to do a wound vac. If you're not familiar with a wound vac is a machine that works like a vacuum cleaner. Basically, it sucks drainage out of the wound. So you put like this little foam insert inside of the wound, and you cover it up really tight so that no air can get in, and it sucks all the drainage out of the wound, and it helps promote wound healing. So maybe they'll have to do something like that. In the worst case, sometimes wherever the wound is, that area will have to be amputated, the leg, the arm, whatever the case may be. And then last but not least, the resident might become septic, and that's something that you really don't want, because once that happens, that'll spread all over the body and your bloodstream, and it'll start attacking your vital organs. So we definitely do not want a resident to become sepsis, because that's too much. And if you work in long-term care, you know that wounds can go from 0 to 100 really quick. The family members will be on top of you like white on rice. Okay? You do not want the wounds to get out of hand. State will be on top of you. You can lose your license, your job. You can lose everything. The facility will be under lawsuits, all type of stuff over wounds. Like, that's something that's very important in long-term care. So we want to make sure we're staying on top of that and being able to notice when something is needs more attention. Some wounds and some residents you might want to pay more closer attention to. Like, some wounds should be changed every day. Some might require less attention every other day. But the ones that require every day, every shift, make sure you are doing those dressing change every day, every shift. Make sure you are labeling and dating those wounds, so you can be held accountable when you're doing your job. Because some people really overlook wounds because of the condition of the resident, or if they're too heavy, or if they're just wore out, tired. But make sure you are doing that, especially for the ones that are severe. If it's every day, every shift, or if it's every day, twice a shift, whatever the case may be, make sure you are doing the wound changes. If you need help, say that. If you need somebody else to step in and do it for you, say that. Just make sure you are making sure they are being taken care of. Make sure you are using the correct treatment when it comes to the wound. If it has an order for you to put antibiotics on it, make sure you are cleaning it good and putting the antibiotic on the wound. You see a lot of people get in trouble with med errors, but wound care being overlooked is something that's like a big thing too, because that gets overlooked all the time, and people get in serious trouble about it. So I keep saying it because you really have to stay on top of it. For the people that have a poor diet and a weak immune system, and they are confined to their bed or their chair, make sure you're keeping an eye on their buttocks, their legs, the back of their legs, everywhere that that's bony, so you can make sure they're not getting any type of pressure sores. And I already said make sure to follow the MD orders on how to care for the wound. And you want to make sure that the wound is progressing. If it is an order in place, make sure that that treatment is working. If you see that it's stalling out, it's not really doing nothing, make that known. Even though the doctor has put those orders in place, you as a nurse see this person almost every day. So make sure you are reporting that to the MD so they'll know, because they're not there every day. So if you notice that the treatment is not working, say something. Let the wound care nurse know. But she's there every day, so she would know. But if you don't have a wound care nurse, make sure you're letting the doctor know that, hey, this is not working. It seems like it's getting worse, not better, and they can switch up something. Maybe the resident is not accepting the antibiotic treatment, or whatever the case may be. If it's an order for you to collect the culture, make sure you are collecting those cultures in a timely manner. And you have to clean everything up, collect it before you collect the culture. Don't go collecting the culture after you remove the dressing. Clean it, then collect the culture and turn it in. And also, when you're cleaning, make sure you're removing all the nasty and bad things, the galls, out of the wound. Don't go packing nasty, or clean on top of nasty. Make sure you're cleaning everything out first, and then going back in and putting all the clean stuff back in. Don't be lazy. Make sure you're doing what you're supposed to do. Pay attention. Things like this happen, and that's why I'm saying it. I'm not just saying it because things like this happen. So, and another thing, G-tubes. I see a lot of G-tubes that are like really, really red and nasty and icky and moist. Make sure you are cleaning around those G-tube areas, because they are considered as basically a wound as well. So make sure you are cleaning that and applying a clean gauze around it. They have gauze designed for G-tubes with a slit in it. If you don't have those, you can create your own. Just cut a slit in it and put it around the G-tube area. Make sure you're staying clean and dry, because that is nasty. I hate looking at a nasty G-tube area. So make sure you are cleaning that, keeping it clean and dry. And that's basically all I have to say about wounds, really. Just making sure you're staying on top of it and don't let it get out of hand, because once it gets out of hand, and then you got to get the family involved and all of that. Y'all know how that goes. When the family gets involved, they might not ever come up there and check on Miss Susie. But if something like that start happening, they're going to stay on top of you like white on rice, and they're going to make sure something gets done about that. So let's make sure we're taking care of it before it gets to the stage where everybody has to get involved. Now you are in a position where you could lose your job, your license, and all of that. So wounds are very, very important, no matter what setting you're working in. But definitely in long-term care, I know it's something that it's a big deal. So let's just make sure we're staying on top of the wounds, keeping them clean, making sure they're not getting infected, and making sure the resident is not getting wounds over and over and over and over and over again. Let's keep them in positions where they won't have to worry about getting the wound, especially if they are really bony or they stay in the bed all day or in their wheelchair. Let's make sure we're getting them changed. Well, make sure your aides, or even if you have to help out, make sure you're keeping them dry, keeping them turned, and all that good stuff. That's all I have to say today about wounds. If you have anything else you would like to add to this video, please leave it in the comment section and we can discuss that. If you have any more topics you would like to discuss, please leave that in the comment section as well. I hope you guys enjoyed the video, and if you did, please give this video a big thumbs up. And also, if you want to know more about wounds, if you're already a nurse, or if you're in school and you guys are going over wounds, you just want to refresh yourself about wound care, use PICMONIC, you guys. I'm going to put a clip in the video somewhere. You can go to PICMONIC, type in wound care or wounds, and it'll give you a lot of information about wounds and, you know, just educate you a little bit more about different things, how they heal, things that help them heal, how do they occur, and things like that. And you can also test yourself once you go over the PowerPoint. So I'm going to definitely insert that in. And if you would like to use PICMONIC, you can get a 7-day free trial. And then if you think that that's something that you want to pursue and keep doing, I will include my link in the description and at the bottom of the screen. You guys can click on that and you'll get 20% off your subscription. So, like I said, if that's something that you think will be helpful for you in your nursing career, it'll all be included in the description box and at the bottom of the screen. I just want to throw it out there, you guys. I'm not getting rich off of PICMONIC. I really do feel like it's beneficial for you guys. I feel like it's something that, you know, that can help you really, really study in an entertaining way. So that's why I'm really like pushing it for you guys, because it's something that, like I said, it's very entertaining. It's not boring. Everything is like short videos. So I think it'll be something that you guys would like, really. So, like I said, if that's something that you want to do, everything will be in the description box. Thank you guys for tuning in to today's video. I hope you enjoyed the video. If you did, please give it a big thumbs up. Don't forget to subscribe and hit the notification bell so you'll be notified when I do post new content. And I will see you guys in the next video.